So we realize that the faith-based organizations mostly they have a large community with which they lead. So what we are trying to do, we are trying to reach each and every community member, and they are with them like most of the times. They really respect their opinions, and if you have an opinion leader such as a respected pastor or priest, you're going to listen to what they say, and we don't necessarily like we're trying to work together with them so that they don't necessarily preach only, but we want them to also take an extra step in the health of their constituents or congregation. So that's what we are trying to do. And also, other than that, most of these church leaders they don't have like enough information to disseminate. So what we are trying to do, we're trying to educate so that they can also reach their congregation. So we're other than them helping us to reach their congregation, we're also trying to educate them, give them like enough information, because we realize that most of their congregation also have different lifestyles, they have different problems, and they face different issues. So we want them to be fully equipped to give proper information at the right time to their congregation. So we've been, yes, as you've said, we've been working in sexual reproductive health for more than 25 years now. We've worked with the ministries related to health. We've worked with civil society organizations and other organizations dealing with health and sexual reproductive health. But we realized that most of the information we provide and the services we urge people to receive are not easily supported by the churches or the other faith-based organizations. So what we are trying to do is we're trying to attract them to join us because there is a huge gap of information for especially for the believers. Even those believers have like a normal life like their account pass. So we need them to also have that information. We need them, a young Christian woman, to be really educated, yes, to believe in God, to do everything to do everything right, and in doing everything right we need them to have full information, because at the end of the day he or she may not be part of the congregation today, but he or she is a Rwandan, and we need every Rwandan to be educated about the issue.
I think it's very relevant and very important for churches or faith-based organizations to be part and partial of this training or conference, because it's a way of making us informed and awareness of how the issue is very serious to our adolescents or to our youth, which is very important for the church or for Rwandan community to be aware of what's taking place, and we know how we can overcome such issues which our youth are facing these days.
So this is a crucial situation we are facing now, where in Rwanda we are experiencing the increasing number of new HIV infections among youth, and also an increasing number of teenage pregnancies in our adolescent girls. So, and the other related problems like drug abuse, where we are seeing our children, our adolescents taking a lot of alcohol. So what it means, it is really important to make sure everyone is part of the campaign. Everyone is contributing and to ensure that we are prepared at the different levels, at the family level, at the community level, at the high level, but also you have this kind of engagement from religious leaders, because you know their interventions in our Rwandan community is very strong. We know on both sides, at the economic level, at development level, churches are contributing to put in place different interventions, especially in education, in health, and the other sectors, to ensure that Rwandan citizens can take the role to be engaged in their development and to ensure that everyone is committed to improve their living conditions. So secondly, at the spiritual level, we see the contribution of religious leaders in the preparation of citizens with reproductive health issues. We can give an example of those adolescent girls getting pregnant or giving birth. They have compounded vulnerabilities in terms of being teen mothers, but also having contracted some infections like HIV and others, but also living in poor conditions, in poverty, also lacking those standards for living conditions. So what we hope from these religious leaders is to make sure they can integrate in their routine work a specific program to educate different categories of people coming in churches, including youth, especially adolescent girls and boys, but also engaging different structures operating under churches like Mothers Union and the Fathers Union, but also to ensure that at the management level of churches, the religious leaders can be skilled, having enough skills to be able to provide accurate information on reproductive health, and also to prepare those young girls and boys with reproductive health issues to be reintegrated in their families, in the community, and to ensure that they can have their rights and also have this kind of social reintegration and the social or economic empowerment in order to help them to think about how themselves they can be engaged to solve their problems in terms of going in a different development intervention, like going to school, going in vocational trainings, where they can produce money and the other things that can help them to overcome all those issues.
For sure, maybe I won't be in the position of recommending for different faith-based organizations or churches, because each denomination or each faith organization has its own way of responding to this. But it is very important to be aware how family planning can be very important to the online community, be important to our community as churches, so that people get children and who they can take care of. But for we, as me, I'm from Anglican Church of Rwanda, I think we are okay with that, because we are aware with the issues or the problem of not family planning. But I'm saying it's very important and it's very crucial for the churches or faith-based organization to have family planning on their way, how they think about it and how the Word of God says about it. But we say that we should have healthy family, spiritually, socially, economically, and also another way of, in other words, having like healthy family is very important.
So in terms of these issues faced by adolescents and youth, I think the contributing factors are various and coming from different sectors. So, but mainly we can talk about poverty in general, poverty in families, at the household level, where children and adolescent girls and boys don't find enough support from their parents, and then go out to see how they can get those support in terms of financial or any kind support from other people. That reason why we are concluding like young people are somehow attracted by those kind of gifts from those people, leading them to have I can say negative behaviors. So another thing is I can say the lack of accurate or right information on reproductive health, on sexuality education, but also not having enough information on their body changes, because we know when a child reach the age of 10, 15, 18, they start seeing some changes on their bodies, but they don't have enough information why and how to deal with it. So that reason why we hope that using this specific channel of religious leaders, this channel can be added to others to make sure we can have various and different channels to reach young people in terms of providing accurate information on reproductive health. Thirdly, I can say that as it is for adults, young people are not having the same accessibility in terms of reproductive health services, where we see countrywide we are still lacking youth-friendly services, because when it comes to youth-friendly services, you can find in a district there is only one YEGO center or youth center providing education and reproductive health services to young people. But we know a district is wide, so to come to this one youth center is not easy for someone coming far from it, and even for someone perhaps not having enough means for transport and also to pay perhaps some services in the nearest perhaps health facilities, because there they don't have youth-friendly services established there. So the lack of access to reproductive health services is a big issue. While we see in our human reproductive health law, it is stipulated that all Rwandans should have access to information and services without any discrimination in terms of age, religion, areas where people live, rural and urban, but also in terms of perhaps some specific group of people, like people, young people, people living in some hard to reach areas, and even some marginalized groups. So we hope that working together with religious leaders, we can improve the access to services through different channels at health facility level, at the school level, at church level, because everywhere churches are contributing, because we are seeing a big proportion of health facilities and schools are run by churches, and also different churches are contributing in the preparation, education, and also in different interventions by putting in place different facilities.
Yeah, after having such information today, what we are going to integrate or to add it in our programs, in our sermons, in our youth programs, in our women ministries, in many ministries, so that our communities are aware and the issues our youth are facing, and so that we are coming together so that we overcome such issues and problems facing our youth and our children in the community and in the Rwandan community too. Sure, the Rwandan youth or the church from the youth from the church are also Rwandans. As you have seen, the biggest part of our youth are really having issues. We at the church have not yet made a research, and maybe I can't tell that's this percentage, but the issue is there. And be small or big, but the issue grows. And if you are not very serious, it may grow even more and more. And this is very serious, and this is really an awareness that we should even have a program of knowing how is it affecting our community, how is it affecting our society, how is it affecting our youth in the churches. Therefore, it's really a homework and assignment we should take to know how is it affecting our churches, the magnitude, so that we know how to combat after having such campaign. Thank you so much.
Obviously, yes, the problem is increasing despite all the efforts that are being done. So what we are doing right now, we are re-evaluating ourselves. We've been teaching young people in schools somehow. We know we've been following the information that these young people are informed. But after training some of them, mostly in Kigali and in the Eastern Province, we've seen that they have gaps in information that need to be filled. So we've also been starting from students from primary 6 to up to secondary schools. Those people also need information, like real serious sexual reproductive health information, not the ones they study in biology or social sciences. No, that's not the information we need them to have. We need them to have full information on what's going on with their life, what's going on in the sexual reproductive health. We've also realized that we often exclude parents in this type of discussions. We are trying to engage the parents in these conversations, because some of them are also not able to give proper information because they themselves are not ignorant about the issues. So we're also educating the parents, and we're also educating these church leaders because they also were the gap that was remaining. So we hope with these efforts, we hope to achieve more than that. Thank you.
So in line with the government laws and policies in place, everyone is requested to make a contribution. And also respecting what others are implementing. What it means, it's like when you are at the faith-based organization level, you have your services, perhaps you are willing to provide to the population. Please do it and make it accessible to the population and promote the universal access, helping all these different categories of people to reach those services. And then also, if someone is coming to you or asking a service you are not providing, please give him or give her, orient her or him where he or she can get those services. This is perhaps the way we can put in place to make sure everyone is comfortable to provide this kind of information, is comfortable to provide, and also knows where he can orient those people in need of services not provided by your organization. And also, I respect this orientation with the government of Rwanda, where in the policy of decentralization, the government is willing to make sure at the grassroots level there is information, the right information on health, on reproductive health, but also services available near the community. And that reason why perhaps religious leaders, they have to know that there is other platforms at community level at the decentralized level, working there, and they can collaborate, everyone putting in place what he can do and he's comfortable to do, and but also knowing that if someone else is providing an additional package of service or information, I can perhaps orient people to go there. So this is perhaps what we can say, because these issues faced by youth, no one can't find a solution alone. So it requires a teamwork, a complementarity, a multidisciplinary approach to ensure that everyone is contributing and all people from different structures, faith-based organization, public organization, private organization, civil society organization, community members, everyone is working with each other to make sure we can provide a holistic approach, a comprehensive program at the community level, because at the end users are the same.
Thank you. Maybe the name and the title, Dr.
So my name is Anisetin Zawonimha. I am a medical doctor, but also an expert in reproductive health, and also I am an ambassador of women's health. Thank you.
Thank you. Thank you.
Yeah, my name is Reverend Sano Stephen. I'm coming from Anglican Church of Rwanda.
Thank you.
Thank you.